Hi, welcome to Rowan School of Osteopathic Medicine. My name is Melvin Ways. I'm a student doctor of the problem-based learning curriculum. When in problem-based learning, we're going to experience self-directed learning as well as team-based learning objectives that help us to solve cases where we have simulated patients. During our learning sessions, which occur Monday, Wednesday, and Friday for approximately 3 hours, we'll have 1.5 hours of learning issues where students have presentations and teach one another. And then we'll have 1.5 hours of simulated patients where we take what we've learned from our learning issues, physiology, anatomy, biochemistry, and apply that to our patient and try and learn heuristically how to solve real-world problems. We also have the privilege of coming to campus and having lab-based learning for anatomy and osteopathic manipulative medicine, and we often work alongside of our synergistic guided learning colleagues. We easily keep up with them and their learning issues, even though we have 2 separate curriculum. And our board scores reflect that because we're very similar in our objectives and outcomes. Alongside of 50 students who are in PBL, our synergistic guided learning partners have facilities, but we also have our facilities. We have excellent learning classrooms, such as this one, where we have computers and learning boards. And we also have our own facilities for osteopathic learning, as well as anatomy, where we have presenters who come in and speak to us specifically in our PBL building. If you have any more questions, please don't hesitate to contact our admissions office.
Welcome to the library. I know that it looks like a little bit of a ghost town right now, but hopefully by the time you guys get here in fall, everything will be back to normal. The library closed down during quarantine, but opened up July 13th and has been running 6 days a week since then. We have a skeleton staff for now. This is Bone Jovi and this is Skelly Clarkson. And they're here to help you along with all of our amazing librarians. We also have a lot of online resources. We have over 100 resources online if you need to look something up or if you need to research something. Everything is very readily available. We also have a chat with a librarian option, whether you're on campus or not and you're stuck and you have something that you need to do. They're here to help you and they're always eager to help and they're super, super helpful. So we have a lot of different options when you're here in the library. We have a bunch of like cubby holes, we have tables. We also have private study rooms where you can take someone like Bone Jovi inside. And that way you kind of get to study in the best way that you can while being on campus.
RowanSOM offers a lot of support for its students. One of the ways RowanSOM does this is through the Center for Teaching and Learning, or the CTL. So the CTL helps students achieve their academic goals by advising them in terms of their schedule, helping them make a study schedule, as well as offering various various learning resources that will help you achieve your goal academically and professionally. In terms of rotations, RowanSOM has many different hub sites that are located all around New Jersey as well as in Delaware. And for your some of your fourth year rotations, you will be assigned to one of these many hub sites where you will do many different rotations such as internal medicine, emergency medicine, OB-GYN. But RowanSOM itself is really good at geriatrics and OMM. So for the most part, we have some of our students come back to the main RowanSOM campus in order to do their geriatrics and OMM rotations.
RowanSOM fosters an environment of diversity, equity, and inclusion on its campus. That includes student wellness and student activities coming together to form our Diversity Lounge, where students are welcome to come and share this safe space individually or collectively to express thoughts and feelings about their experiences at RowanSOM.
So this is our anatomy lab. We're very fortunate enough to have a hands-on experience for anatomy. A lot of schools have been taking that away, so I'm very fortunate to say that I was able to, really work with a cadaver, and it's really helped me with my knowledge today. This is a huge part of the SGL curriculum. PBL also has 24/7 access to the anatomy lab and cadavers. But for the SGL curriculum, which stands for Synergistic Guided Learning, we are a one-pass system, which basically means you learn the normal and the abnormal all at once, which has really helped me in my studies as I went. So you start with an 8-week anatomy course, which is basically here. And it's pretty cool. Like, I was literally holding a human heart like within the 2nd week of medical school, which is pretty crazy. And then you do a biomedical foundations block, and then you also do rheumatology, dermatology, brain and behavior, and cardiology. So you get a nice base, and then you do the rest your 2nd year. So the synergistic guided learning is a nice mix of lectures from professors that are experts in their field. We also have CBL, which is kind of our version of PBL. And that is basically, looking at a case, you have a whole bunch of differentials, and you work with 8 other people and a professor to try and find the diagnosis, which is pretty fun. We also have OMM that is hands-on as well, so we really get like a nice mix of everything. On top of all of that, we also have a lot of courses that make you knowledgeable, but also a great doctor in communicating. We take these classes with PBL. They're medical scholarship and this community service, learning, and leadership. These classes are really there to make sure that you are a successful doctor outside of the knowledge. So medical scholarship is really based on medical research. You have a capstone that is due at the end of 2nd year. That it really helps you kind of know how to do a literature review, because that's extremely important, especially with today's residencies, which is really nice. And we also have our community service, learning and leadership, which is completely based upon knowing how to communicate with your patients, because a lot of medicine is knowing how to say there's a problem and work with the patient to fix it. And having those classes has really made me feel confident that Rowan has prepared me not only to be a good doctor, but to be a great doctor.
Here at RowanSOM, there are a lot of opportunities to participate in extracurricular activities. We have professional groups, we have cultural groups such as OPI and LMSA. We have extracurricular groups such as FitDocs, MedVeg, and Students for Alternative Therapies. And one of my favorite things about RowanSOM is the community that it fosters in its students. One of my favorite programs in the school particularly is the Big Little program, where you, as an incoming first-year student, will be paired up with the second-year Big, and they will be your mentor, and they will be teaching you the ropes and help you transition so that you can have a successful career in medicine.
$99, $100. Oh, didn't see you there. Welcome to the gym. Here at Rowan, we have a full gym here on the 2nd floor of the Academic Center. We have 1 room for weights and 1 room for cardio. We have a full set of dumbbells, a squat rack, we have a bench rack, and we also have a full set of machines. We also have a track, which is pretty exciting. So if you only have a few minutes in between classes, this is the place to be. So this is our interfaith room. Here at RowanSOM, we have a very strong emphasis on wellness. And so this room is really just here if you ever need to think or tap into your spiritual side. We accept every single person with every single belief. So welcome.
Hello and welcome to Rowan Medicine. This is the home of the Centers for Excellence, which are different institutions at RowanSOM that specialize in various fields. So we have the Neuromuscular Institute, or the NMI, which specializes in neuromuscular disorders as well as addiction medicine. The CARES Institute specializes in caring for children from who have undergone traumatic experiences and abuse. And we also have the NJISA, which is the New Jersey Institute for Successful Aging, which is a nationally renowned geriatric medical education institute, as well as a clinic that offers support for the geriatric population of South Jersey.
So this is the histology lab. This is one of 3 lecture halls that we have. Normally our histology labs are here. We also have a whole room for looking at specimens and things like that, which is really nice. That is one main part about the SGL curriculum. SGL stands for Synergistic Guided Learning. And it's really a nice mix of hands-on and lecture material. The lectures are given by professors that are experts in their field. And then we also have CBL, which is case-based learning. And it's kind of like our version of PBL. So it's about a 2-hour session during the blocks. And we get a differential, and we talk with 8 other people and a professor to try and come up with a diagnosis. So it's pretty cool. You kind of get to be like a doctor even in your first year of medical school. So the SGL curriculum is a one-pass system, which essentially means that we cover all the normal, the abnormal, the treatments, all that fun stuff all at once for each system block. So like if you're studying for neuro, you would know the neuroscience, and then you would also know all the problems that can happen and how to treat them all at once. So that's pretty cool. We also have a 8-week anatomy block, which is the first thing that you do, so that's pretty cool. We have 8 weeks of straight anatomy, which is really cool because you kind of get like a hands-on experience of everything that you would be doing. Then you have a block of biomedical foundation, so biochem, micro, immuno, all that fun stuff, and then you start your system blocks. So in your first year, you do rheumatology, dermatology, you do brain and behavior, and you also do cardiology, so you get a nice basis, and then you do the rest of the blocks in your second year. So that's all really good, great to know, like all of that material. On top of that, we also have courses that are going to help you excel outside of the knowledge. So we have courses that we take with PBL, medical scholarship, and the community service learning and leadership course. And these are really nice because they kind of show you how to be a good communicative doctor. So medical scholarship is based on medical research. You do your own capstone by the end of your second year, which is pretty exciting. And then community service learning and leadership is really there to make sure that you know how to communicate with your patients. It's really based on ethics and learning how to give bad news. We actually had a course that was literally called How to Be Human. And that kind of stuff is really important because to be a doctor, anyone can learn the information, but it's all about being able to express what is wrong and work with the patient to make it better. And that, along with all the knowledge that I was given, I really think Rowan has kind of made me not only a good doctor, but a great doctor.
Right now, I'm at the core procedures lab where we learn multiple medical procedures. One of the best things about RowanSOM's curriculum is how we incorporate ultrasound learning as a mandatory part of our medical education. So just to name a few things we can learn in the core procedures lab, we can do administration of injections, IV placements, catheter placements, and even ultrasound-guided central line placement and spinal taps.
So medical school is hard, but it is very important to stay yourself, whether that is working out or, being musical. We're really here to make sure that you stay you. And so this is our music room. It's completely soundproof, has a whole bunch of instruments so that you can really kind of relax and be yourself.
So right now we're in my favorite part of the Rowan Mid building, the Clinical Skills Lab. So the updated Sim Lab has a lot of neat toys for us to play with. So The clinical skills lab is important because clinical learning from the books is one thing and applying that knowledge in a clinical setting is another, and the sim lab allows us to bridge that gap. So here we do a lot of patient encounters, which allow us to practice our interviewing skills, a lot of procedures in the procedures lab, which allow us to learn things such as putting in IVs, doing injections, or putting in caths. And we also have the sim lab right here, which is a simulated hospital room where we can run many different kinds of clinical scenarios, even codes. And these scenarios are controlled by faculty members in the control room, which allow them to manipulate the simulated patient's vitals as the students attempt to engage in the clinical scenario.
This is our student lounge. This is kind of where we go in between lectures or after lectures, or after a session if we're PBL. There's a whole bunch of refrigerators if you ever want to store your breakfast, lunch, or dinner. We also have utensils as well as microwaves if you ever want to heat up your food. We also have our wonderful ping pong table where there's always a game going on. Nice try. We also have a whole bunch of study rooms on this floor as well as another lecture hall for SGL. We have a lactation room as well as our Center for Teaching and Learning.
Behind me, we're in Rowan Medicine's OMM lab. So as osteopathic medical students, OMM, or osteopathic manipulative medicine, is a big part of our medical education. So in the OMM lab, we learn how to use touch as a form of treatment to alleviate our patients' concerns and their ailments. And what's really cool about Rowan is that you actually have opportunities to apply OMM in a clinical setting. And this means actually treating patients in the clinic. So at Rowan, we have multiple student-run volunteer clinics. There are three ones that are worthy of mention. One is the Rowan Health Community Center, which treats the larger population of Lindenwold. The free OMM clinic, which is a student-run clinic where you can actually practice the skills you learn in OMM lab to actual patients, as well as the Rowan Vaccination Clinic, where you can help vaccinate our patients against COVID.